Hi, Dr. Paul. I want to talk about a subject that is very common, very misunderstood. A subject that I treat quite a bit of is ADD or ADHD. So a lot of people misunderstand. Some people think it's only a childhood issue. It's very commonly seen in childhood. We very often seen signs of it in, sometimes even by kindergarten, even preschool, but definitely a lot of times by second, third grade, we see the signs. Poor focus and concentration, difficulty getting things completed, organizing things, listening skills. So there's different types of ADD. There's we call inattentive ADD, which is the most common time where people just kind of space out and the teacher's talking and they're barely listening. They're looking out the window. They're doodling. They kind of like with the Peanuts thing on the wah 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 with the Peanuts cartoon. There's the impulsive ones that do things really impulsively without thinking. The classic is the hyperactivity. That's actually not the most common time, but the kids who are just all over the place, they're in everyone's business, they're up in there, the teacher's telling them to sit down, they're not. So these are different types of ADD. They're all treatable. They're all things that we should be able to recognize. Now, some people actually, and it doesn't really present till later. A lot of people with ADD are highly intelligent, and so sometimes you can't really tell when they're younger, when maybe things are a bit easier. But then it starts to get worse as each step of the way. Sometimes it gets worse in middle school, or it gets worse in high school. Or they get okay and they're okay in high school, but then in college it gets really difficult, and then graduate school. So every step of the way in the education, it gets more and more difficult when you have ADD to accomplish things well and get good grades and all that, and finish your things on time and handing things in on time and all that, and reading in particular. So when you have ADD and you're a reader, and when you try to read, it's very difficult because you read the page, you forget, you have to read it again. So that's another sign is that, and so it's very misunderstood by parents who feel that their kids are too young to treat. They think that I don't want to put my kid on medication. I don't want to put them on speed because they're going to get addicted to it, or it's like putting them on meth. So when you hear this kind of nonsense, it's just misunderstanding the subject. Or if people try to get information online, or they talk to their friends and they would say, I want to do things naturally, and that doesn't work. And so then you have a kid who's really suffering in silence sometimes, and then the kid is not accomplishing what they could accomplish and they should accomplish. And what happens then? Their self-esteem goes down. They feel less than. They feel like their friends can do more. They feel that, why can my friends do this, and why can't I do that? This leads to increased risk of depression. This leads to increased risk of drug abuse because sometimes they just self-medicate. This can increase risk of suicide even. So ADD is a very serious condition, and it really should be treated. And in my view, really, the younger the better. And that sounds aggressive, I know, but it's true. I think that if you treat it, when it needs to be treated, it really sets a kid up for success in life. I've had many examples of patients I've treated over the years that really accomplished what they couldn't accomplish. Now, I have a lot of adults I see who've never been treated, and I take a history from them, and it's an obvious ADD, and they've had it usually for many years. And then when I finally treat them for the first time, they just can't believe it, and a lot of them sometimes are upset that, I'm upset at my parents because I should have been treated when I was younger, and I would have accomplished more if I would have taken this in high school. I probably would have gone to college, or if I would have taken this in college, I might have gone to grad school. I might have gotten whatever. I might have been able to accomplish the things that I could have wanted to accomplish, but I really couldn't back then, or I didn't think I could because it was just too difficult. And now looking back, it could have changed everything in my life. I could have been in a profession that I enjoy more than the one I do now. So there's a lot of that regret with ADD. There's probably nothing more dramatic I see than treating an adult with ADD for the first time, and they see the results and they're just blown away at what they see, and they see like, oh my gosh, this is what people normally feel like, and this is how they can normally function. And it's also very good with relationships. It's very good with listening skills. So a lot of people with ADD have a thought and they have to blurt it out. So let's say someone's talking to them and they're basically half hearing because they have something they have to say and they're not really listening to the person. And they blurt out and they interrupt the person. So when you treat someone with ADD, they say, now when the person's talking, I can kind of sit back and listen to what they're saying and actually appreciate what they're saying and stop until they're done. And now I can talk. And then they listen. And then when they're done listening, then they talk. And then they go, what a concept. Actually, I didn't realize that what I was doing for so long and cutting people off. And it was probably, they probably felt it was rude. I didn't mean it that way. It's just the way my brain works. So, and there's different treatments. There's non-stimulants. It's not, the stimulants are really the gold standard of treatment. They're definitely the best treatment for most people. There's a couple out. Strattera is one that's been around a long time. It's a non-stimulant. It's okay for some people. It's just it doesn't have the power of stimulants for a lot of people. There's a new one called Qualibri. So Qualibri is a new non-stimulant that came out. I've had a little limited experience with it. Kind of plus and minus right now. There's a couple other things like guanfacine and clonidine. There's other medications that can help. But for the most part, the stimulants are the best, and they basically all they're doing is making the chemicals connect. So what's happening in ADD is the chemicals in the nervous system are just not. They're just going too slowly. They're not connecting crisply and properly. And when you put a stimulant in it, boom, everything starts moving and the brain starts connecting and then that's when all the focus happens. And then they're not distracted. So a lot of people say, like at work, like the environment is very busy and they get distracted by other people. They say now I tune them out. I'm right into what I'm doing. I'm able to, and also prioritize. I'm able to multitask instead of being lost in all this stuff to do. I'm able to do this first and get that done, and then I'll do this next. And they're able to kind of prioritize things and understand that I can't do everything at once. I have to pick and choose. And so it really changes everything, in life, really. And it's a great thing when I see. I treat a lot of it, and because I recognize how common it is. A lot of doctors miss it. A lot of doctors don't feel comfortable with stimulants, unfortunately. So if you need help with this, seek out someone who knows how to treat it. There's a lot of doctors out there who know how to treat it. And don't be satisfied until it's treated correctly. Thanks for listening.